So you have your ACL surgery scheduled, and maybe now you're feeling really overwhelmed, not even sure where to start to get ready, second guessing every decision. And I get it. I'm a physical therapist that help patients prep for surgeries all the time. But when it was my turn to go under the knife, even I was questioning what I should be doing. So let me tell you what helped for me, what really did it, and what I kind of regretted so that you can prep better than I did. So let's start with those things that really had helped me. I wanted to make sure I had a comfortable place to rest and recover once I got home from surgery. I knew I wasn't really going to be able to get up those steps into my high bed, so I wanted to make sure that I had a recliner. I did not have one prior to my surgery, but my mother's friend happened to just get rid of hers at the time I was looking for one, so I was able to snatch that up real quick. Then I set up all the things I was going to need right after surgery, and I'm going to go through a couple of those things that I used. One of my greatest purchases was this 3-drawer rolling storage cart. I put it right next to my recliner, and I filled it with all those things that I was going to need in those first couple of weeks of recovery. So in the top drawer, I had my medications, my doctor's notes, therapy notes, some books, journals, and other activities to help keep me occupied. And then in the middle drawer, I kept all my electronics, chargers, and laptop. The bottom drawer was filled of equipment that could help me do my exercises. I could store some snacks in there, put my drinks on top. And just having all those things within an arm's reach away made my life so much easier in those early stages where I was a little bit groggy, not feeling well, kind of in pain, and not really wanting to have to get up very often. Another purchase of mine was a wedge pillow. This really was a must-have early on. As soon as I was able to get up to bed, I was beginning to use this to help elevate my leg, and I didn't have to deal with pillows stacked on one another that would just move around. This thing was really comfortable. It had a quilted top and a grippy bottom, so it stayed in place. I also use it still to this day because I'm on my feet all day at work, and it just feels amazing to come home and get my feet up and elevated on it. Now, I was not allowed to get my incision wet for the first 2 weeks, and I really didn't want to have to deal with garbage bags and duct tape every time I wanted to take a shower. So I did purchase a waterproof shower sleeve, and this thing really gave me a peace of mind. It kept my incisions dry the entire time. Not a lick of moisture got through to it, and it just made showering so much less stressful. The only issue that I had with it is I probably should have purchased a slightly larger size. I did not really take into consideration just how large my leg was going to be with the brace on. So I did have to struggle a little bit to just get it over my brace, but once it was in place, it worked just fantastic. I had my surgery in November, and we ended up having a pretty cold winter. So one of the concerns of mine was, how was I going to keep my legs warm during this time? I did look into some of those snap-away pants, but after I dug a little deeper, I found this set of 3 wide-legged yoga pants. And these things were great. They went right over my shoes and my brace, allowed easy access for the therapist to get to my knee. I would wear them over my shorts once I didn't have to wear the brace anymore. And they're so comfortable, I even use them to lounge around the house. Icing is a really important part to help with pain and swelling management, especially right after surgery. Now, I already had an old DonJoy ice machine available at home, so I just took that knee attachment with me to my surgery, and the surgical team put it on me while I was in the OR, and I woke up with it wrapped in an ACE bandage. So all I had to do when I got home was hook that hose up to my machine. So it was really nice to have one less thing to have to worry about. Now, my surgeon did offer me a rental option, but since I already had my own, the cost didn't really make sense for me. I think it's nice to know that there is that option available, but it's also not the only way to handle icing right after surgery. And little pro tip here, if you do have an ice machine, try using frozen ice water bottles in it instead of just ice. It keeps the water colder longer, so that means less trips to have to refill it. And when you're sore and tired, that really matters. Early on in my rehab, I relied on the ice machine a little bit more often when the swelling was high and I was home. But once I started to be more active and I returned to work, I began using ice sleeves instead. They were just a little bit more convenient, especially if I didn't want to be hooked up to the machine for long periods of time. I was also a physical therapist, so when I'm at work, I have access to ice machines with compression. If I had a little extra time, I would put that on, and I also used that after my own personal physical therapy sessions when I needed something a little bit more aggressive. For me, having all these options was really nice. It made swelling and pain management less complicated. Something that has been a great supplement for my rehab has been my neuromuscular e-stim unit. I had purchased mine actually a couple years ago, so I was really grateful to have it on hand. I began using it right after my injury, throughout my prehab, and soon after my surgery. I was using it multiple times a day in those first couple months after my surgery, and I still use it to today. This is important because it helps counter the pain inhibition of the quadricep muscle that's going to happen with your injury. And then again, following surgery, you may notice how the muscle basically shuts down. And quad function is critical for the health and stability of your knee. My unit is battery operated, and I had put fresh batteries in it back when I began using it in August, and I only had to replace them once since then. So I gotten over 6 months of use out of just the 2 batteries, and I've used it multiple times a day. Now, a little recommendation too, if you are not familiar with how to use an e-stim unit, just take it to your physical therapist. They'll help walk you through it, put the settings on, where to put the pads, and how often to use it. This is something I do with my patients often just to make them feel a little bit more confident in their home use. Now, there is a little safety precaution here. Not all medical conditions are appropriate to be using an e-stim unit. There are certain contraindications, so just make sure that you have clearance from your medical provider and physical therapist before you use one. A couple other pieces of equipment that I used were crutches. I already had some on hand. I was familiar with using them, but I still practice them a little bit around my house just to refamiliarize myself with them. And then I borrowed a shower seat from my mother. This was really critical for those first couple of weeks after my surgery, just to be safe in the shower. I have linked all the products that I have mentioned and used in the description below. A very crucial part in preparing for my surgery was my prehab. I wanted to go into my surgery with as high functioning knee as I could because I know that was going to impact my outcome. Because I did so much for my prehab, I'm going to save all that activities that I did for another video. Now, I wish I had nailed everything perfectly, but even as a PT, there were some things that just didn't pan out as I thought. So let me go into some of those things that didn't work or that I just really didn't need. One thing that I thought I would use while I was hobbling around on my crutches was a cooking apron. I thought this would become inconvenience, that I could use the pockets to help put my cell phone in it, maybe some snacks, some other activities if I wanted to, but I did not use this thing at all. At that point, the less that I had to deal with, the better, and trying to get this thing over around my clothes and tie it up and make sure that it wasn't getting crumpled up around me was more of a hassle than it was worth. It had been recommended to me that when I was still locked out in my brace for those first couple of weeks, that I needed to prop up my foot when I was going to the bathroom. So I had placed some bathroom stools in all my bathrooms, but these things were more of an inconvenience than they were a help. They would get in the way. I struggled to get my leg up on it. And when you are already moving slow and you need to go to the bathroom, you don't want anything that's in your way tripping you up. So I would just use my other leg to help prop myself up when I was sitting on the toilet. Here's the flip side. There's things that I intentionally skipped that a lot of people buy. Just for me, they didn't make sense. The first one was the crutch accessories. Now, I know I was only going to be using crutches for a couple of weeks. I could use them very comfortably, but this is something that I see a lot of my patients purchase, just the extra pads to make things more comfortable for underneath their armpits and for their hands, as well as some accessories to attach to it. I didn't need them, and I didn't really want to spend any extra money. Another thing that I skipped was a grabber. This is also something I've often recommended for my patients, especially if they have difficulty bending over. It can help picking up stuff or even help with dressing. And again, it was something that I really didn't need. And I also did not need to use a leg lifter. Another item that I often would recommend for my patients to help assist lifting their legs, especially if they have a lot of weakness. For me, I would just grab onto my brace and help lift that up if I needed to, or use my opposite leg, and that worked fine. You know, those first few days right after surgery, I was pretty foggy and drowsy from the anesthesia and the pain medication, and the less equipment that I had to manipulate, the better. You know, sometimes the simple adaptations are better than the gear. And now the hard part, those things that I regret, that I wish I would have prepared myself better for and would have made things so much smoother in those first couple of weeks after surgery. The biggest thing I would change had nothing to do with equipment. It had everything to do with my mental and emotional well-being. So my biggest regret is not having enough social preparedness. I knew that mentally this was going to be tough, and I was trying to prepare myself that way of just the inactivity aspect of things. But the social isolation was not even something that I considered. I'm somebody who is around people all day long as a physical therapist and as a personal trainer. And that really began to impact me, not having that interaction about day 4. And I started to really withdraw on myself. So if I would do anything different, I would have set up times with family and friends prior to my surgery, whether it was just to have them come over and sit with me for a little bit, or take me out for coffee, or just sit outside for a moment, just to help counter that loneliness. And another way even to stay connected with those who are in the same boat with you is to get on some of the social networks. There's a lot of great groups that are out there on the various platforms that can really be helpful and beneficial and give you support too. I think it's important to have a plan to be able to stay connected when you're not able to move around as well. And it is okay to ask for help. I know everybody will say, do you need anything? And you don't want to inconvenience anybody, and you might just say that you're just fine. But it is important to reach out and reach out early. The isolation was definitely harder than the physical pain, and I really wish somebody would have told me about that sooner. I wish I had prepared myself for this part of the recovery just as much as I had prepared for the physical. Regret number 2 is lack of good meal prep. Now, that does not say that I did not prep meals. There are several meals that I had made prior to it. My mom had several frozen meals for me as well. Well, what I wasn't taking into consideration is how my tastes and desires are going to change after surgery, and that I really didn't have much of an appetite. It's really important to get all those nutrients in following surgery so that you can recover well. And I was not doing that because I did not feel like eating or eating the foods that we had prepared before. So I wish I would have had some more easy, accessible things to eat, maybe like some protein shakes or bars or along those type of lines. That was something that was really lacking on my end. I think I underestimated just how much energy or lack there I would have following surgery, and thought I would be up to making a few meals, but I really wasn't. My last regret was just a little bit of better home setup. There were some things that I wish I had on hand right from the bat that I had to grab as I went along that would just made things a little bit easier. But in hindsight, I think I did a pretty good job on that end. So just to recap, yes, do your prehab. Yes, get your equipment and set up your home environment that's appropriate for you, but also prepare for your emotional journey. Get your support system going. Don't try to tough it out by yourself. If you're watching this and you're about to have ACL surgery, just know that you're going to get through this. Yes, it is hard, mentally, emotionally, and physically, but you will come out on the other side stronger. If you found this helpful, please give it a thumbs up. And if you're going through ACL recovery and surgery, please consider subscribing, because I'm going to be sharing more of my journey in the upcoming videos. Thanks for watching, and I will see you in the next video.